So how do I pick which technique I want to do? I'm pretty simple, like whichever one is appropriate for the patient. Like sometimes they can't lay a certain way. Most of the time I pick what's more convenient too. Like we'll do the prone one in a little bit, but I end up doing prone more often than not, which is the one I'm most confident in. So I'm gonna have Joe sit back. I'm gonna get him at a height where I can get almost like I'm gonna jump, where I can get down in that loaded position comfortably. I don't want him too high, and then I won't have anything to propel force. If I have him too low, it's gonna be awkward, and I'm probably not gonna have as much control over my thrust. I can use a towel roll between my chest and the area that I want to manipulate to help me get a better end field barrier there. Maybe that's comfort, because I don't want to put my chest on the patient as well. So you can get a towel roll out if you want to. I'm gonna probably not do that with Joe. We'll see. If I don't feel like I get good contact, I will. And then for arm position, it depends on the patient's health and what they can handle and flexibility. But I'll usually either have them kind of reach around, try to grab their shoulder blades like that, or I'll have them grab behind their neck and try to draw their elbows in. But we're getting that position. One leg forward, one leg back is the way I like to stand, so I have good stability there. Go ahead, Joe. Joe's gonna wrap his arms. I'm gonna give him a little bit extra there if he can handle it. And then I'm gonna, you all right?
Oh yeah.
Okay. I'm gonna come in underneath.
I like it.
You like it? I'm just gonna hover here for a little bit. Just kidding. Don't do that. I'm gonna come in underneath, kind of right on his elbows, where I can get a good hug and a thrust. And then I'm gonna bring my elbows into his ribs, so I have good points of contact. People will feel safer the more contact you have. If you're awkward and you only contact them here, and then you only contact them here like this, if you feel awkward, they feel awkward. And that's pretty darn awkward. So like, if they've consented to being manipulated, like get in there and do it confidently. They will feel much safer and it will go much better for you. When we're coming around, we're hugging, interlock. I feel good here. I'm gonna give him a little squeeze. I'm gonna check his end feel there. And then, you okay if I thrust? So I'm going here, and I got good contact where I want to feel nip, and I go, boom, just straight up.